Hello and welcome to Rio Calling, taking over the feed from HIV the morning after for a few days. This is Dan Hall. I'm here in Rio, reporting from AIDS 2026, the biggest HIV conference in the world. Gathered here are the greatest and the good from the global political, activist, community and medical members of those involved with HIV. Joining me is author and ACT UP activist Dan Glass. And together, we're going to get the thoughts from the convention floor on topics that are most raised by the guests of HIV the morning after. Unfortunately, our flights alone have cost us around £2,000 each to get here, and so any help with our expenses would be much appreciated. The link to our crowdfunder is in the show notes. And thanks also to BHIVA, the British HIV Association, for helping to cover our costs, and to HIV iBase for their further assistance. This penultimate episode is about women and HIV. And before meeting with Dan down in the hotel lobby, let's hear from a couple of the podcast guests on this theme. Caroline Guinness co-founded Positively Women, one of the first services in Britain for women with HIV. She was diagnosed in 1986.
For all that there was crossover, being female with HIV was actually very different. We had different concerns to men. A lot of us were mothers, so a lot of it was around reproduction. It was things like menstruation, menstrual blood. Is that infected or not? It was breastfeeding. Things like all trials are all done on men. So any drug trials are done on men, but actually we assimilate drugs differently to men. I mean, to this day, the drugs that we are on are still not trialed on women.
Susan Cole-Haley is a broadcaster and HIV advocate and a mother of 4. 20 years ago, pregnant with her third child, she appeared on the cover of a magazine for people living with HIV.
And some people didn't actually like the fact that I did this naked cover. I was in 4-inch Gucci heels, reclining on sheepskin, heavily pregnant. They actually airbrushed out my cellulite for the magazine cover. So it did look good. And, obviously I do like attention, but I didn't do it for the attention. I really wanted people to know the reality of having children while living with HIV, that women could have children born free of HIV. And soon after the magazine came out, a woman got in touch with me and said that her doctor was trying to persuade her to have a termination because she had HIV, and when she saw the article, she realised that she didn't need to, and then she went on to have an HIV negative baby.
Links to their full episodes are in the show notes. Now then, I'm off to see my co-presenter, Dan Glass. So good morning, Dan.
Morning, Eddie boy.
How are you doing?
Another day, another great day yesterday. I met, one of my highlights of the day was meeting an activist from ACT UP Argentina. I didn't even know ACT UP Argentina existed. And they've started in the last couple of years. And it's brilliant when, some of the ACT UP chapters have closed their doors and now we see new ones emerging. So I like this new evolutions all the time.
That sounds brilliant because, of course, you restarted ACT UP in London, didn't you? So it's not an easy thing to do, I imagine.
No, it's not. And this guy that I met yesterday was so excited when he knew that I was from ACT UP London, and he was banging on about ACT UP Argentina, and I couldn't understand. But we're in touch. Had a lovely time and a lovely chat. And yeah, it's just, one of the things I think I said the other day is that someone said, it's crap that ACT UP still needs to exist. Why do we still have to fight this hard? But as we've spoken about, the funding cuts, etc., we still need ACT UP more than ever.
And we're going to need it more. I mean, my real feeling, my take home from this is that, it almost felt like HIV activism and HIV need was starting to wither on the vine, and you could start just to merge it in with standard healthcare because it was all coming to an end.
Yeah.
My take home from this whole experience is that is in such sharp reverse. And even if all the funding came back tomorrow, that so much damage has been done that that's going to take a decade to put right.
Yeah, exactly. I ironed my ACT UP t-shirt this morning, ready to go, getting on my best jeans.
Wonderful. So today's episode is all about women and HIV. What do you think, purely from a male point of view, you understand some of the issues might be?
The multiple levels of barriers of access to healthcare. And when a healthcare system in itself is sexist and misogynistic, then of course that's going to have a trickle-down effect on the service users. You know, the other area is pregnancy and support for reproductive health. When it comes to not passing on HIV, and there's such a skewed ability to access these services across the world, because it's not just we've got to remember, and this is something that what Luca said in the podcast yesterday.
Luca, the sex worker and activist, yeah.
That of course, we've got to look at HIV. Of course, it's why we're all here, but within the wider ecosystem of healthcare. And if the cuts are coming to healthcare, not just HIV, everywhere, then we see the impact on women's access to healthcare as well.
And before we go and disappear off to the coach and speak with Dr. Tristan Barber from BHIVA, I've just got to report to people listening that Dan and I were invited to what would have been a hot and sexy fashionable party last night, starting at 8 p.m.
Yeah.
Would have been great, full of everyone, but of course it started at 8 p.m. and it was an hour away, and so we went to bed instead.
I know, look at us. But I tell you what, Dan, we're going to make up for when we get home. So when we get home, everyone, can we have a party, please? Because we've been working very hard.
We have been, but it's been good work. I've loved it, I have to say.
Every morning, the first thing I do is wake up and listen to your voice on the podcast.
Lucky you.
I love it. What am I going to do when I get home? No, it has been super valuable. But the party organised last night was by MPAC, who are a really great group. So we'll love to connect with them again.
Absolutely, because we've interviewed some members of MPAC and just brilliant.
Yeah. Brilliant. I think just one thing when it comes to, again, what we spoke about yesterday, I loved your little point about Clapham gays. Like, fundamentally, more women in the world live with HIV than men. And so therefore, logically, how are we going to frame our services in response to that? And then another aspect to it, now you've got me started, is trans women. Particularly if you're looking at the gross attacks that are going on in the UK, like how can trans people and trans women in this case live abundant lives and have the access to healthcare that they need when there's so much institutional transphobia?
Absolutely. And to everyone listening, can I just remind you that at the top of the show notes for this, there is our crowdfunder link. At this moment, we're still just shy of £1,000 short of earning our expenses back, and Dan and I would hugely appreciate it if we could get our money back. If you've been enjoying these podcasts, then please, if you can afford it, do your bit and help us cover our really quite extensive costs.
Well, yeah, every bit is appreciated.
Now then, Dan, finish up your melon and let's go and get the coach to go and see who?
Dr. Tristan Barber. Not just Dr. Tristan Barber, because I've got to wean myself off him. It's nearly the last day. I've got to wean myself off seeing Tristan every day. But, I tell you what, my WhatsApp is kicking off. All the incredible people that we've met. And there is so many more. And I underestimated it. When I was talking about the Global Village yesterday, I was like, there's like 100, 150 groups in there. I was looking at the pictures this morning. There's well over that. There's like maybe 200 stalls.
Wonderful.
So prepare yourself for a lot of excitement and amazing people today.
Absolutely. And of course, this is the penultimate episode. And it's actually the last day of conference today, isn't it?
Yeah.
But the penultimate episode of Rio Calling, the final one will go out tomorrow when we're on the way to the airport.
I know.
Off we go. Dr. Tristan Barber from BHIVA, here we come.
Welcome back, Dr. Tristan Barber, Chair of BHIVA, which is British HIV Association. It's so good to see you again.
Good to see you too.
Please, can we go deep into what is the landscape for women and HIV at the moment? What are your reflections from the conference floor?
I think it's really important for us always to remember that HIV is mainly a disease that's seen in women globally. About 52% of people living with HIV globally are women. So actually more women living with HIV globally than men. And we know a number of factors can particularly affect women. Of course, women don't have as much equality, autonomy and power in many country settings. This can place them more at risk of HIV acquisition. We also know the majority of studies, research studies that are done in HIV are often conducted mainly in men. So it's very important that we look at data that is focused on women specifically. Of course, women also have the potential to become pregnant, and we know that many drugs are not trialed in people that are pregnant because of fears to the unborn child. Many drugs are also not trialed in people that are breast or chest feeding, and many drugs are not trialed very early in children as well. So children can also be more at risk of an absence of research that allows drugs to be used safely and well in them. So there are a number of issues that are particular to women. Also, there are issues particular to women as they get older, thinking about premature menopause, which can happen in people living with HIV. Women may also have lower bone mineral density, and as they get older and pass through menopause, the impact of some HIV drugs may affect that bone mineral density. And in some places, in some country settings, in some clinics, people are perhaps less good at asking about sexual functioning, and we know that sexual functioning and pleasure in women is very, very important, including, again, as people get older, including the impact of the menopause. So there are some really important things that are key about women that are particular and particularly enhanced in women that are affected by, at risk of, or living with HIV. So we really do have to make sure that we always ensure that the research that is mainly done in men is also undertaking decent amounts of women. We can't just translate data that we learn from studies in men into women and assume it's all going to be the same. And then in addition, think about those particular things that affect women across their life course.
My name's Sophie. I am the CEO of the Sophia Forum. It's a UK-based charity that supports women in all our diversities living with and affected by HIV, and we do that through research, policy and advocacy. Women make up over 52% of the global population living with HIV. In the UK, they make up 1/3 of the people living with HIV. Women have never been centred in the HIV response on a global level, and that's part of the biggest problem. We remain invisible. You see the same organisations receiving the majority of the funding, and I think that it's either that it's something that they're choosing to ignore, the structural marginalisation, or they're ignorant to it and don't realise that that's what they're doing.
My name is Garry Brough, and I'm a Programme Manager for Fast Track Cities London. I'm Chair of the UK CAB. Again, when we think about women and HIV, it's back to the issue of equality, the challenges around menopause, before menopause, around menstruation, all of those things that we should know everything about. If it were men's health, we would be finding cures and ways forward with all of these things, but it's just not done well for women.
My name is Brenda Crabtree. I come from Mexico. I'm an infectious disease specialist and an HIV researcher for the past almost 2 decades. There are more women living with HIV in the entire world, and yet the agendas of research are so much many years behind. One example of this is the oral PrEP. I mean, it took us like more than 6 years to also do studies that were acceptable and with representation in women. When the science presented options that could fit of the woman's need, like lenacapavir, then the efficacy was proven. Otherwise, oral did not work before because it wasn't good for the context of women.
Hello, I'm Sita from Iceland Asia Pacific region. When I talk about these issues, particularly women and girls living with HIV, are really isolated because there are so many intersectional issues and structural barriers that are particularly faced by women and girls.
Hi, Laura Waters, HIV and Sexual Health Physician from Gilead and the Royal Free Hospital. There continue to be huge disparities by gender in HIV testing, HIV prevention and HIV treatment. And whilst that varies from place to place, the idea that care is equal for everybody is just not accurate. We look at the UK, not a priority country at this conference, we're a low prevalence country, but we still see significant disparities with women more likely to present late and more likely to leave a sexual health clinic without being offered PrEP, despite having a potential benefit from it.
My name is Kene Esom. I'm a postgraduate researcher at the University of Warwick in the UK. So women living with HIV bear a disproportionate brunt of HIV, the HIV burden, especially in Africa. Part of the prevention messaging over the years has been targeted at adolescent girls and young women following the science to end vertical transmission so that pregnant mothers don't have to transmit. And a lot of work has gone into that, both biomedical and prevention messaging. Much of the funding that's been cut around HIV now is the kind of funds that kind of work, the advocacy to change laws, the advocacy to do little things like help communities organize and reach populations that are not reached easily or effectively by the classic or traditional health system. And so I shudder at what the data around women and frankly key populations and people living with HIV will look like in the next couple of years when we've had some time to track what these funding cuts mean in real numbers for people.
I'm Dr. Chinedu Emmanuel. I'm the country director of Mothers to Mothers, Nigeria. And I think you asked a very good question because, again, your question ties up very neatly with what we do in Nigeria. Basically, we identify and recruit local women living with HIV, and we train them and build their capacity to provide integrated health services to pregnant and breastfeeding women in the health facilities and in the communities. And, the beautiful thing about the work that we do is that most of these women that we recruit and train have gone through the lived experience. They've gone through the whole process of coming to terms with their status, the denial and eventual acceptance to take their antiretroviral drugs. They've also had to deal with stigma and discrimination in the communities. It's even more worrisome because, statistics show that the women are more prone to intimate partner violence. So you find a situation where perhaps a woman is positive, husband is negative, or even when he's positive, they still bear the brunt of intimate partner violence. So these are issues that a lot of our women, especially in the rural areas, have to grapple with.
Hi, I'm Julie Sukar, they, them pronouns. I'm a research analyst at the BCCFE in Canada. So I'm HIV negative. I don't want to speak for an experience that's not mine, but I am trans. It takes a lot of emotional strength to stand your ground and live the life that you have. So I'm a trans feminine person. You probably can't tell from my voice because I've been partying with my cousins from Rio. Yeah, so I'm trans femme. Trans men and trans women are in HIV transmission clusters of straight people, of like MSM, like gay and bisexual men who have sex with men, and among injection drug users. So like we are everywhere. So stop trying to assume who we sleep with and how we obtain HIV. We're very varied people, and so we're gonna show up in everywhere. So make sure all of your guidelines and all of your services are ready for all trans people.
I'm Deborah Carpenter. I'm based in Atlanta and I work with FHI 360. I think issues for most of the African countries is mainly, I would say, the cultural issues that prohibit access or limit access for women. Yeah, because sometimes before they access health care, they have to get permission from their, families.
So I am Andrea. I am a psychologist. I work here in Brazil for the public system health on City Hall of Santos, São Paulo. And I've been doing this for like 25 years. And as I see it, I think that it's about sexism, because women, they can access the public health services more than men even, but they don't have like leverage to negotiate prevention.
My name is Ellie. I'm HIV stigma fighter. From the beginning, there always women left behind. Imagine if men were gone menopause. They already found that solution a long time ago for them. But since it's us women who are facing those kind of things, how we can adjust, how we can deal with the pain. If you leave women and girls behind, there is no way you can win this.
Popping away from the conference floor for just a moment, it's Dan Hall here again, producer and host of HIV The Morning After. Remember, you can support our costs for Rio Calling by going to the crowdfunder. The link is in the show notes. And please do subscribe, rate and review these specials and the main podcast. You can do this in your podcast app. And if you like what you hear, please do tell your friends and colleagues. Now then, let's hear from a couple more of the podcast guests on today's theme, and then it's straight back to the conference floor. Ellie Harrison was diagnosed in 2018 at 21. She kept it secret for more than 3 years.
When I first got into activism, I think I always used to say, like, if it helps one person, that's enough for me. And I know from my Instagram DMs and the private messages that I have from women that I have far exceeded one. I'd imagine I'm in the thousands by now of people that I've been able to help or save, some of them, which is beautiful. But at the same time, is this reminder of it isn't just gay men from the 80s that have HIV. Like, HIV doesn't give a fuck what race you are, what gender you are, what sexuality you have. It doesn't. It's a disease. And it can affect absolutely everyone. And it is important that, I think particularly with like young women and HIV, there is still probably thousands in the UK of young women like me living with HIV, but there isn't the same representation probably in the community because it's quite stigmatized for a young woman to catch HIV, right? The stigma I live with is that I'm a massive whore and I somehow went above and beyond shagging to get this to happen to me and I deserve it. That's not the case. And even if it was, does it matter? But I think that just adds to this fear of women not wanting to talk about having HIV.
Angelina Namiba is a Kenyan-born HIV advocate, diagnosed in London in 1993 and told that she had 6 months to live. In this clip, a friend has something to tell her.
A friend of mine, around that time also, after I had been told, came to me and said, Angelina, I have something to tell you. And I said, what is it? And she says, I have HIV. And I went, yes, finally, another woman in London who happens to be my friend and also living with HIV. So then I told her and she took me along to support groups where I received a lot of peer support, which helped me to cope. I got offered a job almost the same week that I got my diagnosis. And I had to make a decision. Do I take this job or not? I thought, let me take this job and keep myself busy whilst I'm waiting to die. So my attitude helped me a lot as well. And with hindsight, taking that job was another best decision that I made because working and volunteering has kept me going all these years.
So my name's Sophia Strachan. Solutions would be for the funders to look at who they're funding and who they're not funding, and to ask themselves and reflect, are we funding the same people here? Are we leaving women in a place of disadvantage by not funding the programs that are designed and would be led by women? In academia, no research should be done without the involvement of the community. Sitting in a steering group doesn't necessarily leave people feeling empowered.
My name is Garry Brough. I think men need to step up and be accountable and fight and push for greater inclusion of women in the spaces, with whether that's HIV, whether it's medicine, whether it's politics.
My name is Brenda Crabtree, but in my opinion, we would start of putting more women in a position of leadership. So they can raise their hand and say, this is my problem, this is important, this is affecting my quality of life.
My name is Kene Esom. Address the structural challenges that frankly make women's life more difficult than it needs to be. Whether it's access to education in some of the contexts where the burden is significant, whether it's paid childcare, whether it is childcare and other care responsibilities that women have. And let technology help us work HIV prevention and treatment around people's real lives.
I'm Dr. Chinedu, Emmanuel. I'm the country director of Mothers to Mothers, Nigeria. Let them understand that it's not a death sentence. So as long as they are consistent with their drugs, they're able to lead very normal lives. They're able to have children that are negative and doing very well. And, that's why we actively look out for those women who have gone through the experience, and then we're able to train them to support other women, especially pregnant women, so that when such women, receive that level of support, based on the fact that these women are now role models to them, it helps them go through the entire continuum of care, and they turn out happier, and they turn out, better empowered, to support their families.
My name is Ellie. I'm HIV stigma fighter. Work with us, work with women, listen to women, support women organization, give them what they need to empower the community. Don't just go sit on table and decide for women, because you're not a woman. You don't go on menstruation. You don't face the menopause the problems. You don't fall pregnant, do you? No, but the men, they got there and they forget we women matters.
Okay, so brilliant. Dr. Tristan Barber, Chair of BHIVA, British HIV Association, thank you so much for coming back to us. Can you give us a few of the key insights on the landscape and the solutions and what we can do next in terms of the roadmap ahead?
Thanks for the question. I think I'm going to start with some different levels. So I think we have to, as HIV clinicians and researchers, we have to keep pushing for research trials that include women. We continue to see research presented that has a predominance of men included, and we have to keep forcing those who fund research, those who design research, including drug companies, to make sure that they include adequate numbers of women. The time is now. It should have happened years ago. We've been saying it for years. There's no excuse now, I think, to not design studies that specifically include women. The second thing I think is that we need to continue to advocate for women, particularly those who are in country settings where laws may limit their freedoms. We know that limiting freedoms does not allow people to access HIV prevention, does not allow people to access HIV care well. And we know that laws that restrict women's freedoms are harmful, and we need to keep challenging those. And third, we need to support our community groups that specifically support women. I think spaces for all women that are supported by other women remain incredibly important. We know that peer support in the UK is incredibly important, and that some women prefer to receive peer support from other women. So supporting community groups, making sure that we challenge restrictive laws, and also including women in research. This cannot wait.
So Dan, we're running a little bit behind, so we should have started editing an hour ago, but we've been too busy chatting with wonderful, inspiring people.
We have never-ending inspiration. It's amazing. We're very lucky.
How's your morning been?
My morning's been really good. I'm trying to work out how to summarize the incredible experiences that we had in like 5 key take-homes. But I'm going to let my brain settle, because we've still got the closing ceremony today.
Yeah.
So the hive mind of all the kind of crystallization of what we've all collectively learned. I'm particularly interested in the roadmap from here until the next International AIDS Conference in 2 years' time.
Oh, it's in 2 years, is it?
It's in 2 years. Yeah, it's in 2 years.
Okay.
And we'll find out where later today. What we can collectively hope to achieve, what inequalities we can make less unequal, and what focuses we take home, in our case, back to London for our communities to really, really sharpen what we're doing.
Brilliant. And it's been a great morning for me. I've spent most of it handing out flyers, really, for the podcast. Today was, although it's a much quieter day today, I was worried that I wouldn't be able to hand them out to people, or there wouldn't be anyone to hand them out.
No, with that face.
But exactly. But actually, a bit quieter is easier because you can authentically engage with people. They're not flowing in quite so quickly, and you can have a quick conversation. I'm just having a quick look at the stats already, and already we've had more downloads than yesterday, and it's only just 12:40.
Wow.
So the numbers. Yeah. So handing out flyers, old school. Works. It works better than Instagram and all that stuff. Just standing in front of people and saying with authenticity, I do a podcast speaking to inspiring people, then they join. So it's been great. And and I'm excited about getting this episode out. There's some really fantastic women in it. And as you know, we both chatted about, we were really keen that this episode wasn't about two men telling women how they think of
Well,
people.
you know what? I'm going to start a little protest, Dan. I mean, what about us?
What about us?
What about
Who's
us?
looking out for us, Dan?
Yeah, what about us, you know? Maybe, no, let's not go down the men's right thing. No.
So tomorrow's episode is our final Rio Calling, as we'll be heading up to the airport, and the episode is all about isolation.
Yeah.
Very quickly, what do you think will be some of the interesting things in tomorrow's episode?
One thing that I've been thinking a lot about, and I went to an amazing talk yesterday with Derek, and Mark was there as well. Derek was facilitating it. About...
Oh, it's Derek who featured on yesterday's episode.
Yeah, we love Derek. In the Silver Zone, about growing older with HIV. And we had a good chat about what the realities are for the elder generation living with HIV, both not just accessing healthcare, but accessing holistic support and getting the housing, getting the community love people deserve. And that's a big thing for me in terms of like intergenerational love and support when it comes to combating isolation.
We'll have a good chat about that in the morning over breakfast, because I know you've written a lot about that in your books.
Yes.
Which are? Promote them?
My books are United Queerdom, From the Legends of the Gay Liberation Front to the Queers of Tomorrow, focusing on key interviews with some of the legendary founding members of Pride. Second book, Queer Footprints, a guide to uncovering London's fierce history, which is like a queer radical walking guide to London. And now I'm working on the working title being Act Up, Rise Up, a kind of people's history of AIDS activism. And of course I've got to stipulate in there that it's just a tiny, you can never have a people's history of AIDS activism unless you have 10 tombstones worth of books. Excuse the like weird pun. And yeah, so it's all intergenerational love and support and wisdom and connection is all a key thread throughout all of it.
That's fantastic. And I look forward to joining you tomorrow and Dr. Tristan Barber from BHIVA.
Yes, of course. I can't wait. We're going to see each other today at the closing ceremony. Maybe it's Dr. Tristan Barber's even on the panel.
Maybe he's going to do a dance.
Maybe he will. Don't know if he went out to the party last night. We'll have to find out.
The party that we didn't go to because we went to bed at 8 p.m.
I know, working hard.
Brilliant. Look forward to tomorrow, Dan.
Oh, thank you, Dan, and well done again.
Thank you, you too. To everybody listening around the world and everyone from conference listening, many thanks. We're temporarily taking over the feed here from HIV The Morning After, and my thanks as ever go to co-host Dan Glass and to BHIVA's Dr. Tristan Barber. Pauline Nidu at UnstoppableMonsters.com composed the theme tune, and of course additional thanks go to BHIVA, HIV iBase and Murray Lang. And please remember, challenge HIV stigma wherever you find it. This is Rio Calling, and I've been Dan Hall. See you tomorrow for our final day here at AIDS 2026.